Daily switching of energy from sugar to energy from fat improves muscle strength and brain function. Stronger and smarter with less hunger. I'm Dr. James Hurd, a physician specializing in preventive behavioral medicine and cardiovascular rehabilitation. About 2 million years ago, modern humans had to struggle getting enough to eat. They often had to survive days, weeks, and even months on what their bodies had stored in tissues and organs. There was never too much to eat. It wasn't so bad. There's enough energy in 10 pounds of body fat to last a couple of weeks. In fact, with nothing to eat, muscles were stronger and brains functioned better than when there was lots to eat. Using body fat for energy, they weren't even particularly hungry. Today, in the US, there's almost always plenty to eat, more than enough. Numerous meals and snacks all day long. That keeps blood levels of sugar, fat, and insulin high, even during the night, continuously burning sugar for energy and storing fat. Some sugar is stored with water in the liver and muscle. During the night, sugar is released from the liver, supplying energy for 10 or 12 hours. Even longer in obesity and type 2 diabetes. With high levels of blood sugar, fat is never released for energy, just stored. Stored fat is only released when insulin levels are very low. Most people in the US carry body fat stores more than ideal. Men store 20% of total body weight as fat, and women store 30%. Also, food is available and eaten all day long, from early morning to late in the evening, often 12 to 16 hours a day. The 6 to 8 hours of sleep at night are barely enough to use and store all the sugar and fat that was consumed during the day. Organs and tissues become adapted to sugar metabolism and resistant to fat metabolism. The muscles, liver, heart, and brain forget how to burn fat. Hunger for something to eat drives appetite for more food, even when there's enough energy stored as fat for 2 or 3 months without eating anything. Time-restricted meal planning stimulates the ability to release fat from storage and use it for energy. Normally it takes 10 or 12 hours after a meal to lower the levels of sugar and insulin and convert to fat metabolism. Gradually extending the time between the last meal or snack in the evening to the first meal of the next day lengthens the time for fat metabolism to release fat from stores. Exercise helps the process of converting to fat metabolism for energy. Exercise training not only uses sugar for energy, it adapts skeletal muscle to absorb more and more sugar from blood. Calorie restriction also decreases excess calories that must be stored in muscle, liver, and fat. Hunger and appetite gradually decrease as metabolism becomes accustomed to using stored fat for energy. This is the point of all this effort to adapt to using fat metabolism. When your body becomes accustomed to using stored fat for energy, you no longer feel uncomfortable consuming fewer calories. Your body no longer resists mobilizing fat from subcutaneous storage. Take advantage of the normal overnight separation between meals while sleeping. Gradually extend 6 to 8 hours while sleeping to include a longer separation between your last meal or snack in the evening and the time you retire for the night. The first objective is to reach a consistent separation between meals and snacks of at least 12 hours. If you eat breakfast at 8 a.m., make it 8 p.m., the time you absolutely finish eating anything for the day. Start by doing that 1 or 2 days in a week. Next objective is to extend time of separation to 14 hours. Make the time you finish eating for the day closer and closer to 6 p.m. Again, start by doing that 1 or 2 days in a week. Final objective is to extend time of separation to 16 hours. Make the time you finish eating for the day closer and closer to 4 p.m. Our metabolism can use sugar or fat for energy. When levels of sugar and fat are high, sugar is used and stored, and fat is stored. When levels of sugar and fat are low, stored fat is mobilized and used. Sugar metabolism is the most direct path for energy quickly available. After a meal, when sugar is almost all used for energy or stored, insulin levels fall. When energy is still required, fat is released from storage and burned for energy. Exercise helps the process of converting to fat metabolism for energy. Moderate and strenuous exercise quickly use up all the energy stored as carbohydrate. Then fat is released and burned for energy. Calorie restriction also lowers the excess of calories that must be stored in muscle, liver, and fat. Physical fitness and extended time without food improve nutritional fitness. Your cellular metabolism can learn to burn fat. Hunger and appetite gradually decrease as your metabolism becomes accustomed to using stored fat for energy. Gradually extend 6 to 8 hours while sleeping to include a longer separation between your last meal or snack in the evening and the time you retire for the night. The final objective is to extend the time of separation to 16 hours. Daily switching of energy from sugar to energy from fat improves muscle strength and brain function, stronger and smarter with less hunger. Let us help you train your metabolism for good nutritional fitness. If you would like to participate in our Type 2 Diabetes Recovery Program, you should sign up. Click on the link in the video description. After you sign up, you'll be asked to register and supply a few points of data concerning date of birth, smoking history, height, weight, blood sugar, and daily injections of insulin. We will call you and establish secure communication links for reporting and reviewing results, starting with fasting blood sugar, basal heart rate, and body weight. Then I will call you to ask about your medical history with type 2 diabetes. Also, we will discuss details of your goals and objectives for recovery from diabetes. In addition, we will set up an action plan for recovery. There is no charge for this service as long as you continue to report on a regular schedule and continue to work towards recovery from diabetes. We are dedicated to helping people recover from type 2 diabetes and maintain good health using telehealth technology.